his insights on the experience of Thailand in handling the war, the drug campaign or the drug problem campaign. So Mr. Tangay is a Canadian who has been based in Thailand since 2004. So he has been there at the height of Thailand's drug war and continues to work there developing drug policies. He facilitated dissemination of lessons learned and important developments in the field of harm reduction across Asia. He currently works as a freelance consultant, providing technical support to implementing agencies, governments, and multilateral organizations in the context of HIV and other health and social issues that impact on the lives of people who use and inject drugs. Most recently, he worked on Princess Bajrakitayaba's, I hope I pronounced that right, Inspire project, probably documenting decriminalization policies in Europe and how those lessons could be applied in Thailand. So may we call on Mr. Tangay for his presentation.
Thank you, Madam Chair. Thank you, everyone, for having me here today. I'm very pleased and very excited to have the opportunity to present some lessons learned from Thailand. As I understand it, there's a lot of parallels between the current situation here in the Philippines and what has happened in Thailand. So I think it'll be useful to go over some of the evidence on how the war on drugs has impacted the country in Thailand. But before starting my presentation, I'd like to just say a few key points. One, Law Enforcement and HIV Network is a network of police officers. It's a global network of police officers that are supportive of key interventions for HIV prevention and reducing corruption within police forces. We work directly with police officers that are supportive of these types of interventions. On the other hand, I also work with an organization called Ozone in Thailand, which is a peer-driven harm reduction organization delivering services to people who use drugs to prevent HIV, hepatitis C, and overdose. So I work very closely with drug users, and I work very closely with the police. So I think that's kind of important to situate how I'm going to present all this evidence. The other thing that I'd like to underline is that I'd like to dedicate my presentation today to all the victims of the war on drugs. The victims that have been the victims from the Philippines, the victims from Thailand, the victims from Mexico, and from all over the world who have suffered unjustly at the hands of governments who have implemented these policies. I think it's also important to point out that, why am I speaking on Thailand? Yes, there was a war on drugs. It's very similar to the Philippines. But there's also a lot of similarities between the two countries, between Thailand and the Philippines. Both are ASEAN members. You're both members of the Association of Southeast Asian Nations. Both countries have very strong health systems. Both countries adhere supposedly to the rule of law. There's emerging democracy in both countries. So there's a lot of parallels between the Philippines and Thailand. So I think a lot of the lessons learned that I'll be presenting might actually be easily applicable in the Filipino context. Lastly, before starting, my slides is going to be a lot of evidence. So I'll be talking a lot about numbers. I've tried to make my slides as light as possible, but given that we're talking about evidence-based responses, the numbers are quite important. So I apologize if the presentation is a bit numbers heavy, but I think that we'll all benefit from this presentation. So just to give you an overview of what I'll be talking about today, I'll start by giving you a quick historical overview of the policy development in Thailand. I'll talk about the 2003 war on drugs, specifically about the impacts that has generated over the years, the current situation in Thailand, and how those lessons can be applied to the Philippines. Most of the evidence that I'm going to be presenting today is from a report that I prepared with a Thai colleague. that documents, that assesses the applicability of different decriminalization models to the Thai context. And we did a comprehensive literature review, so most of the evidence that I'll be presenting is going to be in that report that should be published before the end of the year by the Inspire project, operated by the royal family in Thailand. Skip this. So, a bit of history. In 1959, Thailand made opium illegal. Heroin became illegal in Thailand only in 1959. So it's been, what, 60 years? Less than 60 years since drugs have essentially been criminalized in Thailand. Before that, for hundreds of years, the Thai government was actually involved in drug production, drug distribution, drug trafficking. It was controlled by the military, it was controlled by the government. So the shift from government involvement in the drugs to today is quite radical. We went from a fully government-operated drug market in Thailand, where opium and other drugs were available in pharmacies, to today where drugs are hyper-criminalized, over-criminalized, with devastating impacts. But it wasn't until the 1970s that the Thai government realized that the drug issue was very important. And in the 1970s, from 1975 to 1979, the Thai government developed the essential policy framework for criminalization of all drugs. So the 75 Psychotropic Substances Act provided the framework for doctors, for medical professionals to access drugs. In 1976, the Narcotics Control Act provided the framework for criminalization of abuse of the Psychotropic Substances Act. And in 1979, the Narcotics Act actually created the schedules and the system of penalties for people who break those laws. In 1996, in the mid-1990s, there was the global methamphetamine epidemic that particularly impacted the United States, the Philippines, and Thailand. 3 countries were most impacted by this epidemic, and they're quite relevant because we've been discussing yesterday about the United States. Today we're talking about Thailand, and we've been talking about Philippines for the past 2 days. This was such an overreaction when Thailand criminalized amphetamines that they criminalized even medical products. Remember Dr. Hart yesterday was talking about Ritalin. In Thailand, even FDA-approved medical products based on amphetamines were criminalized, taken off the shelves, and no access to medical professionals to these substances. It was clearly an overreaction to the situation that was emerging at the global level. In 2002, the government initiated the Narcotics Addict Rehabilitation Act. This was essentially intended to divert drug offenders to treatment. But in effect, it was a tool for the government to scale up compulsory detention in the name of treatment. In 2003, 2004, that's when the war on drugs started in Thailand. The most intense campaign of the war on drugs was in 2003, 2004. There were 3 rounds, and by the 3rd round, I think the 3rd round ended in early 2005 or late 2004. After 2003, 2004, the bloody campaign, there were a number of drug control strategies that were passed by the government. All of these strategies are essentially tools to reinforce law enforcement powers to control the drug market. So it expanded a lot the possibility of law enforcement agencies to tackle drug issues while reducing oversight over what those organizations were doing. So please remember those strategies. They are going to be important in a later slide. Particularly 2 of those. One is the 5 fences, the 2009 5 fences strategy is particularly important for what comes next in my presentation. Essentially, the policy objectives were always focused on supply reduction. To a certain extent, but much lesser extent, demand reduction was also incorporated in the Thai drug control strategy. But essentially, supply reduction was operated mainly by law enforcement, by police. And to a lesser extent, the demand reduction was managed and operationalized by public health officials. So the 2003-2004 war on drugs has been coined as the world's bloodiest war on drugs. It obviously does not compare to what Lisa was saying just a few minutes ago. The numbers in Mexico are much, much higher, but what we have to understand is Thailand war on drugs was very concentrated in a 9-month period. And most of the damage that was done in the first 3 months of that campaign. So it was the intensity that led to academics and media to coin Thailand's war on drugs as the world's bloodiest war on drugs. Now, obviously, you'll see in a minute that Thailand does not hold that title anymore. I think it belongs to the Philippines. So just to go quickly over how the war on drugs was implemented, it was implemented by increasing penalties for drugs. It was about forcing people into compulsory detention in the name of treatment. Blacklists were developed to identify people in villages without any oversight, without any controls. Arrest and seizure targets and quotas were put in place to motivate and to incentivize police, as well as a system of reward and penalties for all government officials, not only the police, but also for public health. So if they didn't perform, they would be demoted or sent to a rural province. Up until recently, all of these are still in place in Thailand. So essentially, the policies of the war on drugs are still very much in place in Thailand. The violence has stopped, but to a certain extent, but the policies and the approaches and the mindset, the paradigm that drives the response in Thailand is still very much grounded on these strategies. So what was the impact? And this is really what I want to present today, is the impact of the war on drugs in Thailand. So here you have extrajudicial killings. In Thailand, during the bloody war on drugs, there were also extrajudicial killings. A total of 2,275 individuals were assassinated by police forces outside of the context of their purview. In addition, 320,000 people surrendered to authorities. There were countless of people injured in the process as well. And again, these 2,275 extrajudicial killings and the 320,000 surrenderies all happened in the first 3 months of the campaign. There are also immense human rights violations that were committed, especially in compulsory drug treatment centers and police stations. In compulsory detention centers, there was forced labor, denial of treatment, physical, psychological, and sexual abuse, and compulsory detention are essentially, without due process, are essentially all human rights violations. So these centers were one of the main tools of the war on drugs in Thailand. It's important also to look at the impact that the war on drugs had actually on drug use. So I'm sorry, I missed a key point. As I go through my slides, we'll be looking at the evidence of the impact on the war on drugs, on drug use, on the justice system, on the health system, on delivery of services targeting people who use drugs, as well as on public opinion. So we'll start with drug use. As you can see from this table, the number of drug users has varied. It has increased very rapidly in the 1970s to the 1980s, and kept rising. Then there was a little dip, and it's on the rise again. So especially important is the two figures at the bottom. So before the war on drugs, there was a national household survey that was conducted by academics. They found that 3.5 million people aged 15 to 60 had consumed amphetamines or amphetamine-type stimulants in the past. 10 years later, after 8 years of war on drugs, 3.5 million amphetamine users among 12 to 65-year-olds. So clearly, there has been zero impact on consumption. People continue to consume drugs, whether there's a war on drugs or whether there isn't. That's very clear from the data that's presented here. The other thing that's important is that during the war on drugs, people actually didn't really stop using drugs. People reduced their consumption of certain substances, but in effect, they just switched to using other drugs. So for example, this study that was conducted in Thailand showed that 85% of people had stopped injecting during the war on drugs. But approximately a third of participants in that study simply switched to using other drugs like opium or alcohol or benzodiazepines, which again increased massively their health risks because those people weren't used to dealing with those substances. As Dr. Carl was pointing out yesterday, dose, mode of administration, etc., are all important components in how people's bodies react to the impact of drugs. So that put the war on drugs essentially forced people to have more higher-risk drug-taking behaviors. I think this is one of the most important slides in my entire presentation. This was a team of scientists who came to Thailand to evaluate the impact of the war on drug policies on the scope of the drug market. So essentially, they looked between 2009 and 2011, compared drug users' access to drugs. And they found that between 2009 and 2011, drugs became more readily available. And remember, there were those 5 strategies that forced more war on drugs approaches between 2008 and 2011. So clearly, again, the impact of those policies has not constricted the market, has not reduced drug use, and has not reduced the negative impacts of drug use on people's lives and bodies. Now I'd like to talk a bit about the justice system in Thailand and how the war on drugs has impacted there. So here I've got the number of people arrested at the top in Thailand. Both tables are about the number of drug-related arrests, yeah? So you can see from the table above that almost 80% of arrests in Thailand are related to drug issues. A small proportion are covering other crimes. So according to the data here, 86% of drug-related arrests led to a criminal prosecution in the year 2000. That same year, 76.5% of convictions were related to drug cases. So this shows that police spend a disproportionate amount of time and resources on policing drug-related issues. And we'll confirm that through some other data in a later slide. The other impact on the police was that the violence has significantly increased. During the war on drugs, yes, there was extrajudicial killings, there were human rights violations, but that continued after the war on drugs. It's like the war on drugs legitimized and normalized violence in the context of drug control. So this study showed that 37.6% of people reported having been beaten by the police. These are people who use drugs in Bangkok. And experiencing that type of violence was strongly associated with a number of higher risk behaviors that could lead to health problems. Similarly, the war on drugs normalized evidence planting and entrapment. So this study showed that 48% of people who use drugs in Thailand had experienced entrapment by police, had police plant drugs on them. Out of those 48%, 48% had been asked for a bribe. And the average size of the bribe was about $150, which is very high considering that the average annual monthly salary for Thai citizens is about $200 to $300 US. So it's half of a month's wage. And this is kind of important. You know, the police chief in Thailand, when he gets confronted with these issues, he says, no, this is not bribes. This is part of our traditions. It's part of our culture. So it's okay for the police to ask for money. It's okay for the police to put drugs on people that don't have them to get them arrested. These things are okay because they're part of our culture. They're part of our traditions. Similarly, police used a lot of unlawful techniques to extract confessions from people who use drugs. I think this report came out last year from Amnesty International that looked specifically at how police officers in Thailand coerced confessions from people who use drugs in order to meet their quotas. The other impact is that police have been implementing these drug testing campaigns, these urine tests that they submit people to, with no expectation of privacy, with no confidentiality, and fundamentally, these urine tests is a public health intervention that's being implemented by people who do not have the skills or the understanding to apply these tests properly. Not only that, but these urine tests do not say anything about if someone is addicted or dependent, or even if they have consumed drugs. Let me give you an example. If I'm locked in if we're in a small room, I light up a joint and you're sitting next to me, you're probably going to test positive for marijuana. If you eat a bagel with poppy seeds, you're going to have opiate metabolites in your urine. But it does not mean that you have used or consumed drugs. So these urine tests are profoundly flawed tools for us to determine how we respond, how we treat drug users, and how we develop our policies. This has also led, the war on drugs has also led to disproportional sentencing. So after people are arrested, go to court, the sentences that they receive for drug-related crimes are very high. So there's one increasingly famous case of this young lady called Ms. Supatra Runarung. She was caught on the Thai-Lao border with 1.5 pills of amphetamines worth about $5. It was her first offense. She was sentenced to 25 years in prison and a fine of over 1 million baht, which is around $30,000 US dollars. I personally went to visit some prisons in Thailand and in one session, we interviewed 24 prisoners who were convicted of drug offenses. These 24 prisoners were all young. They had an average age of about 32 years of age. The 24 prisoners collectively received 825 years in prison sentences. Let me repeat that. 24 people received 825-year prison sentences. That's an average 34.3 years in prison for each of those individuals. On top of that, there were 4 death penalties, which can't really be quantified, but still. And the other interesting thing with those 24 prisoners is that collectively they had in their possession 138 tablets of amphetamines. So that's an average of 6.5 years of prison time for every pill. And two of those cases in the prison was particularly interesting because there were 2 guys driving a car. They had 1 pill in the car. Both were sentenced to 25 years in prison for the same pill. So it wasn't cut into 2, I have a half, you have a half. No, there was 1 pill. And both were charged 25 years for trafficking. That makes no sense legally, and that doesn't make even sense mathematically. Yeah? 2 people cannot own 1 pill. These are incarceration rates in Thailand, and you can see they've been skyrocketing for quite some time. So between 1996 and 2002, 53% of inmates were incarcerated because of drug-related crimes. That quickly rose. In 2002, 62%. In 2012, it was 64%. And in 2016, it's 73%. In addition, the prisons are all overcrowded. They're operating at over 150% capacity. And again, most of the people who are imprisoned are there because of drug-related crimes. And this has particularly affected women. Thailand has the highest incarceration rate of women for drug-related crimes. Over 80% of women incarcerated in Thailand are there because of drug-related crimes. So you can see just on the public security, on the justice side of this equation, there's been some pretty devastating consequences. Now, if we look at health, well, HIV prevalence, hepatitis C prevalence has not really gone down. It's been pretty stable among people who inject drugs, who are one of the most vulnerable groups to contracting HIV through sharing needles and syringes. So HIV has remained pretty stable because the Thai government still does not implement harm reduction programs, and very few interventions target people who inject drugs to reduce HIV or hepatitis C transmission. In addition to that, overdose has been increasing. So in Bangkok, the study showed that 30% of people who use drugs had an overdose and survived, obviously. Whereas 68% of participants in this study said that they had witnessed at least one overdose in their lives. So this is kind of important, again, because there are no mechanisms in place in Thailand, no official mechanisms in place to reduce overdose, to prevent overdose, and to manage overdoses when they occur. The data that was from this study is confirmed by projects, by civil society projects on the ground. Those three little pie charts at the bottom come from civil society project, which kind of confirms what those academics found in Bangkok. But this was done, this project was being implemented in 19 provinces and confirmed the data from the overdose study. Similarly, studies have shown that there's a disproportionate amount of stigma especially from the public health sector towards people who use drugs. This study specifically noted, and I quote, that, I'll quote later, that specifically said that that health professionals treat people who use drugs, quote, as the lowest moral group of the country. And people were increasingly, the worries from drug users when they report on the stigma that they experience in healthcare settings, they note a fear of disclosure of their personal information, the lack of confidentiality, and overall lack of trust in the services provided by medical professionals, because again, they discriminate against people who use drugs. This has had another major impact on health-seeking behaviors. So people who use drugs who end up in compulsory treatment, have been refused health care, are shamed because of their drug use, or cannot earn money, are less likely to seek health services, to seek assistance from health services for any kind of medical condition. This is not just related to HIV or Hep C or overdoses. These are people who will not go to healthcare to treat their tuberculosis, to treat their cold, to treat a sprained ankle. They are so distrustful, again, because of the stigma, that they do not engage as much with the health sector, which increases the burden on the state and the community as well. And this is I pulled a quote from this report, which was a civil society report published in 2015, which I think captures how people feel in Thailand, at least how drug users feel in Thailand. One of our clients said, I would rather contract HIV, an uncurable chronic illness, than being rearrested by the police. So it shows that, people are more willing to contract a lifelong illness than possibly have to interact with the police. So now we can look, I think, at implementation on services that are being delivered for people who use drugs. Generally, 3 pillars: prevention, harm reduction, and treatment. So we'll look at all 3 of those here. The prevention strategy in Thailand is particularly special. It includes 3 key pillars: education and sensitization, increasing immunity to drugs, and urine testing. So education, mainstay pretty much of all globally drug prevention programs, school-based education and sensitization, but their programs are based on the DARE model, which Dr. Hart mentioned yesterday. Those programs were evaluated and have shown very little benefit in terms of preventing initiation of drug use among young people. In fact, some studies even show that these kinds of DARE programs actually stimulate young people to go out and try drugs. So their prevention strategy in terms of education is counterproductive. The second strategy is immunity, and this is the slide I put up here. So the idea that they have in developing their immunity or immunization strategy is the same as a vaccine. So essentially, you vaccinate the community by removing the drug users from the community, from the schools, from the employment, from the family. That way, the drug user cannot transmit addiction to other people in the community, which is obviously a very flawed concept again, because drug use, addiction, is not a communicable disease. It doesn't work like that. And again, remember I mentioned the policy from 2009, the 5 fences strategy. This was exactly the concept. It was to put a fence between the drug user and the community, the school, employers. So essentially, they marginalize drug users. They kick them out of their communities, which reduces their chances of being rehabilitated and being productive members of society. In terms of harm reduction, there's been a lot of back and forth with the Thai government on these issues. The Thai government remains skeptical about the value of these interventions. However, earlier this year, in February, the government did pass a national harm reduction strategy. However, the strategy did not come with an operational plan, with a budget, with targets, or with performance indicators. So essentially, the policy is there, but there is no way to operationalize it on the ground to make it work for people who use drugs, which leads to very poor coverage in terms of service delivery, in terms of harm reduction service delivery in Thailand. For example, only 14 needles are distributed per drug user per year, whereas WHO recommends that a minimum of 200 needles be distributed per user per year. So we're very far away from adequate coverage with needle syringe programs. Similarly, opioid substitution therapy with methadone, the coverage, only 8.7% of people who inject drugs have access to methadone in 2016. And this is after 60 years of implementation of methadone by the Thai government. HIV testing and counseling, fewer than 10% of people who inject drugs get tested. Antiretroviral treatment, the medication to treat HIV, to prevent HIV from becoming AIDS. Fewer than 2% of people who inject drugs have access to those medications. And again, there is no overdose medication officially provided by health agencies in Thailand. So again, shows that people who use drugs their needs are not being met, and they're at disproportionate risk of contracting Hep C, hepatitis C, HIV, suffering an overdose, contracting tuberculosis in prisons, etc. So this shows, again, in terms of harm reduction, that over time, so during the war on drugs between 2003 and 2004, there was no money invested in harm reduction, zero. At the peak between 2009 and 2014, an average, about $3 million was being granted by the Global Fund to prevent HIV among people who inject drugs through harm reduction services. Despite that significant amount of money, that translated in only $73 per injecting drug user per year. So again, if you think that we need to purchase 200 needles for every drug user, needles cost 25 cents a pop in Thailand, so that's $50. You don't have outreach workers, you don't have drop-in centers, and you've already spent like 2/3 of your $73 to just purchase the needles. They don't have condoms yet, we haven't purchased condoms. So the budget have been vastly insufficient, and which explains why coverage has been so low, partially. It also shows that the second table at the bottom shows that the unit cost for a service to be delivered to a drug user is significantly higher than other key populations. These are HIV prevention services. In this case, they were measuring the cost for HIV testing. So conducting an HIV test with one injecting drug user costs $150, $850. Compared to $71 with men who have sex with men. So this is the cost of criminalization. Having the war on drugs, having policies that criminalize drug use and drug users means that when we try to reach out to them, when we try to deliver services, the cost will be significantly inflated compared to any other services we deliver to any other target group. This also is very interesting. This shows the fiscal space in Thailand for drug-related issues. So essentially, in 2015, there was about $3.5 billion invested in drug control. 90% of that went to law enforcement, and the majority of that went to the police. Significantly, or more than $2 billion out of the 3.5 went just to the police. And this is just for drug-related issues. Yeah? This is not the police budget. This is the police budget for drug-related issues. Only 10% of the resources are going to health. And I've been very generous in including compulsory detention and drug prevention as health interventions, because as I've shown you, drug prevention with urine testing is a law enforcement strategy. Compulsory detention is a law enforcement strategy. So there's very, very, very little funding even going to harm reduction. You can see 0.05% of the total resources went to prevent harms related to drugs in Thailand. In terms of treatment, so in terms of treatment, the Thai government has really banked on expanding these treatment strategies. So essentially, this is the data from 2011 to 2012, shows that in one single year, they sent over 560,000 people to these treatment centers. A significant number, about 170,000, were sent there through the criminal justice system. And even those that say voluntary, in Thailand, as I imagine many other countries in Southeast Asia, voluntary is also, if I'm a parent and I see my son or my daughter using drugs, I can volunteer them, even if they're adults. The drug users essentially lose their right to consent to treatment. In a way, these types of policies show that drug users are not mentally competent to make their own decisions, which again is a human rights violation. Treatment without consent is always a human rights violation unless there are mitigating circumstances like mental incapacity. So in Thailand, during the period from the war on drugs, from the end of the war on drugs in 2004, there were 35 inpatient treatment facilities in Thailand. That rose very quickly. By 2012, there was 1,278 centers for treatment of people who use drugs. So in less than 10 years, we went from 35 to 1,278 centers, which is a disproportionate investment, especially considering that these have not been proven to show any kind of positive impact. In fact, the Thai government uses the metric of enrollment to show its success, yeah? Here they show 560,000 people registered. Yes, we have succeeded. We have reduced the drug menace because 560,000 people who use drugs are no longer in society. They're outside. They're contained. This was a press release from the Ministry of Health that essentially says, we're successful. We have been successful in addressing drug abuse because such high numbers of people have enrolled in such treatment. However, UN agencies in 2012 called on all governments, especially in Southeast Asia, to shut down these compulsory drug treatment centers because for several reasons. One, they are ineffective. They do not reduce drug use. People come out of there 18 to 90% relapse rates from those centers. The gains are not sustainable in terms of reducing drug use. They are unsafe for clients. Again, I showed you earlier there was enormous human rights violations perpetrated in these centers. They are costly. It costs a lot of money. It's especially costly if it's ineffective. Imagine for Thailand how much money they needed to spend to build, an extra 1,250 drug treatment centers. The cost of operating those centers, the staff costs, etc. It's a disproportional investment in something that does not produce results. And lastly, the UN says that these centers are insufficiently capacitated. In Thailand, many of those compulsory centers are not operated by doctors. They are operated by military, by police, by the Ministry of the Interior. So they are not there to treat, to rehabilitate, to provide health services. They are there to keep people away, to immunize the wider community against these dirty drug users. This has also had an impact the war on drugs has also had an impact in terms of who engages with these issues in Thailand. So this is an overview of the who's who in terms of drug issues in Thailand. Mainly, civil society groups have been left to take care of health issues among people who use drugs. There's very few government agencies that actually deliver services or are interested in supporting people who use drugs. And even among civil society groups, there is a decreasing number of civil society groups who are willing to take the risk to do this kind of work and to mobilize funds to support people who use drugs. So it leaves a major gap in terms of the response. Also in terms of meaningful participation, so one of the key principles in designing effective policies is that you involve and consult with the affected communities that you're trying to assist. If you're trying to resolve the drug problem, it's important to consult with people who use drugs. Thailand is fortunate. There was a Thai drug users network that was registered and established in 2002, just prior to the war on drugs. However, their space for advocacy, for service delivery, is constantly challenged by the government. So they have a network which is very helpful and supportive for people who use drugs, but their impact has been very mitigated by opposition from the government. Also kind of important is that those CSOs that do the service delivery at community level through outreach face a lot of hazards. I was explaining to colleagues that under our project in Thailand, which is mandated and approved by the Ministry of Health, still, the police arrest 2 to 3 of our outreach workers every month. At the peak, we had 12 of our outreach workers that were arrested in a single month. So these civil society groups who take this on are also disproportionately affected. It's not only the drug users, it's also the people who deliver the services to the drug users who are targeted by the police and by law enforcement. So there's a lot of risks in tackling this, and we have to be cognizant. We have to understand that people who are delivering those services also need to be protected. There needs to be some safeguards, some safety and security protocols to ensure that people can do their jobs effectively. And also the impact of the war on drugs is that it's made it very, very difficult to collect any kind of data about drug use in Thailand. Yeah, when you're at risk of being shot if you're identified as a drug user, then you're not going to come out to talk to a scientist, even if it's someone from the outside like Dr. Hart. It's going to be very difficult to trust anyone with your story. So data collection about the war on drugs, the impact of the war on drugs, essentially all the data I have been presented was not collected during the war on drugs. It was collected after the war on drugs, after a lot of trust building had been invested to recreate that bond between the civil society groups, the academics, and the drug-using population. A little bit on public opinion. I think this is kind of important given that President Duterte enjoys significant approval ratings from the population here. While in Thailand, also the Prime Minister Thaksin Shinawatra, who led the War on Drugs campaign, also enjoyed very high approval ratings, over 90% essentially. So over 90%, but by March 2005, within 6 months of the end of the bloody campaign, the campaign of violence, within 6 months, 74% still supported the war on drugs, but 68% were not confident that the government would achieve its objectives. So that means that people support something that they know is going to fail. As before the war on drugs, there was a most recent poll that was conducted in 2012, which revealed that 88% of respondents felt that drugs represented the most serious problem for Thailand, a national security issue, essentially. 71% of respondents felt confident that the government would be able to solve the drug problem, which contradicts the poll that was done in 2005. 75% of respondents agreed that drug laws must continue to be strictly enforced, despite some significant problems with prison overcrowding, as I've shown. 66% of respondents said that drug offenders must be subjected to drastic action, despite having some of the most severe sentences for drug-related crimes in the world. 63% agreed that law enforcement-led anti-drug campaigns must continue to be carried out. And this is despite 50 years of law enforcement-led drug control that has not produced any significant results. And despite repeated calls for evidence-based decisions, 62% of the respondents agreed that morality must continue to drive drug control, not evidence. The population wants morality. So what does the road ahead look like for Thailand, post-war on drugs? Well, there's been a shift. I must say there's been a shift. So since about 2013, there's been some new policies, some openness from academics and government officials to discuss drug-related issues, drug control issues in a rational way grounded on evidence. The Thai government has recently passed the harm reduction policy. In 2016, they decriminalized hemp, which had been criminalized as Category 5, like marijuana. National Legislative Assembly approved amendments to the Narcotics Act, reducing penalties for drug crimes, and another harm reduction guideline was developed in 2013. So there is some movement. There's an emerging new paradigm that's coming out of Thailand. In 2016, the Minister of Justice of Thailand, General Paibun Kumchaya, said in an interview with Reuters, this interview, quote, "The world has lost the war on drugs, not only Thailand." So the Minister of Justice, a general in the army, acknowledged that Thailand had failed the war on drugs. Let me repeat that because it's important. High government officials in Thailand have admitted that the war on drugs had failed in their country. It had not produced the results that they were expecting. So based on, in this interview, the Minister Paibun also said that he was interested in looking at alternatives such as rescheduling methamphetamines and other amphetamine-type stimulants, looking at decriminalizing cannabis and kratom, an indigenous psychoactive plant from Thailand, and scaling up evidence-based drug dependence treatment and other health interventions. So there seems, again, to be an openness to look at alternatives to law enforcement-led approaches. At the 2016 UN General Assembly Special Session on the World Drug Problem, the General Paibun Kumchaya was there and made a speech, again, confirming that Thailand might not decriminalize, but that they were certainly looking for alternatives to what had been implemented in the past 15 years. And we're very lucky in Thailand because the motivation for reform has come from this lady. This is Her Royal Highness Princess Bajarakitiyaba. She leads a project on prison reform that has grown because the project was initially designed to reduce prison overcrowding. And they quickly realized as they initiated their project that prison overcrowding was essentially driven by bad drug policies. So the project has kind of shifted to tackle drug policy issues. So she's been at the tip of the spear in advocating and pushing internally the Thai government to change its approaches to drug policies. And we're very lucky that the princess has also been named as the UN Goodwill Ambassador for the rule of law for Southeast Asia just a few weeks ago. So she has a significant role to play not only in Thailand, but across the region. And I'd encourage you to write, to communicate with the Inspire Project, to mobilize their support for the activities that you're trying to do here in the Philippines to reduce the impact of the war on drugs. So Thailand is looking at every corner of the planet for examples, good practices, good ideas for what they can do to improve their drug policies. As I mentioned, I was working with the princess's group to assess decriminalization models from 5 European countries, unpack those models, and identify which components could be applied in Thailand. So what does this all imply for the Philippines? Well, first of all, I think it's important to point out that there's important parallels between, the war on drugs in Thailand and the war on drugs in the Philippines. Both promote violence. Both have encouraged vigilantism. Both have mobilized significant popular support. Both have ignored significant amount of evidence. Both have insulted international organizations and advisors. Both have shown very limited transparency or accountability in their implementation of the war on drugs. And both have been convinced that they could win the war on drugs. And again, I didn't put what was at the beginning, but both use blacklists, increased penalties for drugs during the war on drugs, etc. So you can see that the mechanisms that are being applied here is essentially a copy-paste from Thailand's playbook, from Thaksin Shinawatra's playbook. Duterte didn't invent anything. He just copy-pasted exactly what Thaksin did. And let me show you, even more compelling. These are quotes in the media that have been reported. And they show very systematically. Thaksin says, drug dealers must die. Duterte says, you cannot wage a war without killing. So Thaksin says, they're not human. Duterte says, they're not human. For a person, we're doing this to save our children. They both say this. It's the same rhetoric. It's the same discourse. Exactly the same. It's adapted, obviously. It's not the same words, but the ideas behind these sentences are exactly the same. So again, it confirms that Duterte didn't invent anything. He copied his strategy on what Thailand did 15 years ago. Do I need to expand? So I think, for the Philippines, what this implies, I know that people are angry and frustrated, that there's huge challenges. You're facing huge challenges in your country with this war on drugs. I think that there is an opportunity here. There's an opportunity given, there's more than 1 million people who have surrendered. Many of them, well, how we deal with those surrenderies is the opportunity. The war on drugs, the deaths, the injuries, unfortunately, besides documenting those human rights violations, doing some advocacy, there's not a lot that can be done. Thailand, for example, after the war on drugs, there was a court case, but no one was prosecuted, no one was charged. So very unlikely, in my opinion, that these things lead to concrete outputs. However, with the 1 million surrenderies, there's an opportunity to develop a nice, effective, evidence-based system for dealing with people who use drugs. As Dr. Hart was saying, to start with proper assessments. Are people addicted? Do they need services? What are their health needs? What are their psychosocial needs? Do they need employment? Do they need education? Do they need family support? This is where it all starts. And from there, to develop an appropriate response that includes harm reduction, that includes evidence-based treatment for those who need it. Not for everyone, for those who need it. But there's a genuine opportunity here. Your Philippines is receiving funds from international donors to scale up treatment. Well, it needs to be done properly. Otherwise, those resources are going to be wasted and will do more harm than good, as I have shown with the examples from Thailand. Not only is there an opportunity, but I think there's an opportunity for the Philippines to show leadership here. Again, across Southeast Asia, countries have relied on compulsory detention in the name of treatment to deal with their drug issues. If Philippines does away with that model and implements a proper cascade of services, of health services, based on evidence, then there's a chance that Philippines could be an example for the rest of the region and for the rest of the world on how to address these issues appropriately. Thank you very much for your attention.